All right, there are advances in medical research right here in Chicago, and it's brought forth what we call Super Tory, a robotic stunt baby used to help doctors save the lives of real, gravely ill newborns. And Super Tory, get this, does everything imaginable. And here to tell us more about it is Jim Arquetto from Gomard Manufacturing and Dr. Beverly Robin of Rush University. Thank you so much for coming out here today on the plaza early this morning. And you brought with you Super Tory.
It's a Super Tory.
Super Tory, I'm sorry. So this is a $40,000 robotic newborn, I suppose. Tell us about it.
This is really designed to help Dr. Robin.
Because it's actually warm and it feels just like a baby.
It's warm, it's moving, and I can make it cry for you, Anita, as well. And what's so important is this can really help Dr. Robin in her practice to ensure that everyone's properly trained for these critical patients who are so ill. And that's how Dr. Robin would use this for training.
So, Doctor, when you're operating this, I suppose you can teach your students how to operate, how to touch the baby, what would hurt, how do you do that?
So we train entire teams in neonatal resuscitation, and we use a mannequin like Super Tory to train in technical skills, so things like putting in a breathing tube, how to give mask ventilation, and those kinds of things. And then we also focus on the teamwork. So how does the team work collaboratively to take care of a baby like her, to prepare medical students, residents, physicians, nurse practitioners, respiratory therapists to take care of critically ill babies in newborn intensive care.
Now, I'm feeling this right now, and I can feel a heartbeat, actually, and the baby is moving, it's heavy, and it's warm, just like a real baby.
This is designed to be so realistic that when Dr. Robin's students are working on this, they get taken and mentally to a different place, so they're actually believing that they're working on a real baby. So if we uncover her a little bit, Anita, you can see and feel her skin and see what that feels like. It's soft like a baby's skin, and all of these ports here are designed to connect to real equipment. So this snap would be for a real EKG, so Dr. Robin and her learners could get real EKG results. Hook her up to a real ventilator so they know what to do when a real patient is being treated.
You know, Doctor, I always wonder about that when people are learning medicine. I mean, people can talk and they can tell you things, but with a baby, it's so imperative that they're able to get it right.
To get it right,
they're
and
so
get it right
tiny,
quickly,
and everything, everything is so tiny on the baby. How do the students like it?
They love it. Really, because again, it's so realistic. There's some things we can do to even enhance realism, like put a little blood on her. After delivery, babies often have some blood on them. So really put the whole team together, and they really enjoy it because how much, nothing could be better than practicing on a baby like her than actually practicing on a real baby.
Are we going to be
first?
Can we expect to see more of this type of training in more hospitals around the country?
Oh, absolutely. In fact, these go worldwide. We manufacture them in Miami, Florida. So it's designed, developed, and manufactured right here in the U.S. And Super Tory is a baby, but we have full adults that deliver babies and adult males with amputations that bleed and everything in between.
It's amazing work that the robotics and the technology now these days, and it's in real life, applications. That's wonderful. Thank you so much for both of you coming out here this morning to talk with us here. Yeah, we're going to toss it back into you, Darlene. This is pretty incredible. I got about 11 pounds here I'm holding on to.
I heard you during the commercial break talk about how this is kind of creepy and it feels warm, like a real baby.
Yeah,
all right, thank you.